Good afternoon, everyone, and welcome to Path Data Collection. We're going to spend the next hour and a little bit talking about how we collect path data, how it's useful, and so on. So before we get started, I'd just like to introduce myself. My name is Jonathan Cox. I've worked for C4 Innovations for about 6.5 years. Prior to that, I used to manage a continuum of care in Georgia, and prior to that I was living and working in London in the UK, where I did all kinds of street outreach and rapid rehousing and all that good stuff. So Amy, why don't you introduce yourself?
Sure. Good afternoon, everyone. I'm Amy White. I'm a training and technical assistance provider with C4, been in this role for the past 10 years or so. And prior to that, a path outreach worker in Boston, Massachusetts. So familiar with the PATH program, but also it really varies based on the location and the state that it's being implemented. So really enjoyed getting to know a little bit more about the North Dakota program, and excited about the challenge of making data collection somewhat engaging for you today. So we'll see how we do.
Okay, all right. So I'm assuming that over the last 18 months, if you weren't familiar with Zoom then, you are probably pretty familiar with Zoom now. But just in case we have some folks that it's relatively new to, I just want to talk through this slide. We're joined today by Bina. Bina is our tech support person. If you're having any problems, you just type it into the chat and Bina will reach out to you. If you're having a lot of problems, you can put your phone number into the chat and Bina can call you direct. You can see on the bottom left, there's a mute, unmute button, and then again, there's a start video, end video button. The only other thing that I want to make sure that people are aware of is that if you need to use the captioning, that's down towards the bottom of the right next to the leave meeting button. You can choose to get a full transcript of what we're saying. My accent makes it somewhat challenging. It gets it mostly right, but not every time. So if I start watching you inappropriately laugh at random moments, I'm going to assume that it has badly translated something I've said, or maybe not. But anyway, it should work relatively smoothly. And if you have any problems, please don't hesitate to reach out to Bina. Next slide, please, Amy. Okay, so what are we going to go through today? We're going to talk a little bit about why data collection is important and how we do it, what our data elements are, understand when we put what into the HMIS system, talk a little bit about how we gather the data in a trauma-informed way, and then think about how we improve our data collection practices. And I think that it's important to understand that HMIS is something that is specific to you. Amy and I, unfortunately, cannot comment on your HMIS system except to empathize with you when you experience frustrations using it. Every COC buys its own HMIS system and then designates an HMIS admin to run it, which means that, the HMIS system that I have, that they use in Georgia, is not going to be the same or even have the same interface as the HMIS system you have in North Dakota and the HMIS system that is in New Jersey with Amy. So it's important to remember that. They're all held to some standards in the HMIS data manual, but it does mean that they may have differing interfaces and go through things in differing ways. All right, let's get to the next slide, please. So we're going to think about why collect the data. We're going to talk about the path data elements and what they mean. We're going to do a little bit of a workflow, and then we'll put it all together over the next hour. We'll take the next slide, please, Amy. All right, why don't we pull up our first poll, please? This is one of those where, you know, select all that apply. So don't just put the, you know, pick your number one. It would be interesting to see each part of the role that you play in data collection. We're going to spend a couple of minutes on this, and I can see that one person's entered it so far. And you've selected all that apply. That is, you know, we'll, all right, it looks as though we're getting to that. So, do you want to go ahead and end the polling and show the results, please, Amy? Okay, so pretty wide range of answers. 3 out of 4 of you are entering data into HMIS. 1 of you is supervising people who enter data and running reports. Only 1 of you has to enter data into PDX, but a couple of you review data reports, and then 1 of you uses data to make program decisions. And we do this poll because we want people to understand that there is more than just entering data into HMIS, which is what most people do. It's the most common response, but there are a whole heap of other things that need to happen. So HMIS reports need to be run. Data cleaning needs to happen. People use that HMIS data to make program decisions. People review the data reports to understand what's going on. And then finally, in order to, you know, get our money from SEMSA, we upload data and enter data into PDX. So it's more than just entering data into HMIS, although that is critical, but there's, you know, a lot of other functions within our work as well. All right, I'm going to stop sharing. Okay, can we close that out? All right, so why do we collect data? I mean, there are a number of reasons, but really, data is a critical piece of the service that we provide to folks that are experiencing homelessness. Without this data, we can't make decisions around what works, what doesn't work, what's useful to our clients, what's not useful to our clients, and you know, we're unable to get a picture of overall of what's happening at both the granular and the macro level. So, you know, we use it to organize and keep track of our client information. You know, we like to show that we are doing good for people, so we want to show what our outcomes are. You know, we use it to track the services that we provide to people and give, you know, understand the, you know, what happens to people once they leave the path service and move on into housing. And then, you know, if we can get that good picture, and that's not always that easy from HMIS, but if we can get a good picture of what's happening, we use our HMIS data to firstly showcase the results of a valuable service. And that's what outreach is all about, is, you know, providing those critical services, but also being able to showcase just exactly what we've done. And then we, you know, hopefully we get people to make adjustments to resource allocation and ensure that funds go to where they're most needed. Amy, next slide, please. We all have anecdotal knowledge of what goes on in our community. But it is often really surprising when we start to aggregate our data. And so using path data, we can understand characteristics of the homeless population. You know, where are they prior to experiencing homelessness? When I used to manage a shelter in Atlanta, an emergency shelter, we were absolutely convinced that folks came from out of town and they'd roll through on the Greyhound and they'd walk 2 blocks and they'd enter into our shelter. We were utterly convinced most people who are homeless hadn't come from Atlanta until we started really doing some HMIS data analysis. And we discovered that 90% came from local zip codes, and we were absolutely wrong. So where are people prior to experiencing homelessness? Our data can show that. What do the assistance do they receive, and what do they need? How long do they experience homelessness? You know, our length of time is one of those 7 system performance measures, and it's absolutely critical. Where do people go? What happens when they leave the system? What are their outcomes? And do they return to homelessness? And that recidivism measure is a really interesting piece. But it's also, you know, one of the things that we've, at C4, you know, we've spent a lot of time looking at HMIS data for a number of communities, including, you know, the street outreach data. And to give you a good example of something that we had no idea about until we started really delving into the data was, you know, firstly, we knew that Black and Indigenous people of color were overrepresented in our unsheltered populations. But, you know, data and analysis that we did within C4 for communities showed that Black and Indigenous people of color, despite being unsheltered, were less likely to be put forward for rapid rehousing and permanent supportive housing. And we did that by collecting this data, starting with street outreach and moving all the way through the coordinated entry system to prioritization and rehousing. So when people ask me, why are you collecting data? That's why we collect data, because we can make genuine decisions and we can make adjustments to do that. Next slide, please, Amy. Okay, we're going to do another poll question. Let's launch that poll, please. Okay, I'm seeing 3 people enter it. Let's give the last folks another minute. Okay, so we can end the polling now at your convenience, Amy. All right, so again, a varied response, which is always interesting when it comes to HMIS and data. Half of you have said entering data accurately into HMIS, and I feel your pain. Nobody went into this field because they have a genuine love of HMIS data entry. It is critical, but it is hard work at times. You know, describing the assessment and survey, half of you have found that hard. You know, requesting information from clients, that's part of our outreach, and you know, that can be hard, but it can also be, you know, a real part of the building of the relationship. Knowing the time points when data elements must be collected. This is why I would never do this training without Amy, because she's very good at that kind of thing, and we'll come on to that section a little bit later today. Understanding how to use the data, you know, HUD is making great strides in teaching people how to use how to do the data analysis. And finding time to enter data. I understand that it isn't the most exciting part of the job, but it is a very essential part of the job. Okay, thank you, Amy. Can we shut that down? All right. Okay. All right, so let's talk a little bit about what we're putting in there. And the UDEs, they've been around for a number of years now. They have gone through some evolution, although in more recent years, a lot less than it used to be back in kind of 2010 to 2015. But we've got the names, we've got the identifiers, then we've got a bunch of other stuff, and let's go through it in our next slide. Okay, so universal data elements. These are our initial identifiers. The social security number, the name, the date of birth. If you've ever worked in HMIS, you know that duplication of client records is a very frustrating part to managing your database. So we use our name, our social security number, and our date of birth to ensure that we're not entering duplicate records, and that those are our principal identifiers. Those don't get moved out to PDX, and they're not reported directly in our PATH annual report. They're simply primarily used as identifiers. We go to the next slide, please, Amy. Okay, then the rest of ours. Now these are demographic elements. They all have a direct relationship with our PATH annual report. So we go through some of the descriptions around race, date of birth, gender, ethnicity, and veteran status. The prior living situation and the disabling condition we use as part of the calculation around chronically homeless. And that's really one of the major pieces that has evolved over the last 5 years, that using the data to identify folks that are chronically homeless. Prior to the last either 1 or 2 iterations of our data sets, we used to have to try and do that manually by hand around figuring out chronically homeless. And a piece of research I did with our COC in Georgia found that we were really quite bad at making a decision over whether somebody was chronically homeless or not. It wasn't something that case managers particularly used or prioritized. And so now that it has been kind of like codified into our data sets, it's actually a lot more simple to build out whether somebody is chronically homeless or not. Why is that important? Well, it's important because over the last few years, HUD has really decided that if you want to use permanent supportive housing, they want to prioritize chronically homeless folk to get into permanent supportive housing. And so in the annual competitions, they went through a number of years where they encouraged COCs to make all of their permanent supportive housing eligible primarily for chronically homeless individuals and families. I'm not going to say that every permanent supportive housing unit is now only for chronically homeless, but it has moved in that direction a lot over the last 5 years. Additionally, someone being chronically homeless means that they get prioritized through the coordinated entry system a lot higher and faster than they would have done a number of years ago. So, getting those data elements right is, vitally important. Can we go to the next slide, please? And then finally, our project entry and our project exit dates, we use that to determine our path reports and, you know, who's an active client, who's an active record during that reporting period. And then I think we have one more, don't we? Yes. And then, you know, if we want to measure outcomes, and it's very important as path folks that we do, we need that destination. We need that client outcome. And, you know, it gives us that last piece of information when we're looking at our HMIS data sets to make data-driven decisions. Okay, feel like we've covered universal data elements. Amy, do you want to take us on?
Sure. All right, we're hopping now into program-specific data elements. And hopefully, you know, these elements are looking familiar to you based on the data that you're collecting on a day-to-day basis. And our goal here with this initial section is just to give you a sense of how this all connects back to how the data is actually used. So when you're feeling like this is a ton of data, why do I need to do all of this? You have a sense of where it connects back to and how it can actually be useful. And especially for those of you who are doing that direct data entry into HMIS, understanding your role, like you're the start of that data getting there and being useful. I remember when I first started with data collection and analysis, one of my colleagues had used the phrase garbage in, garbage out, which I think is very common with data analysis circles. So it, you know, when it comes to data analysis, it really relies on the end users, those initial end users entering the data accurately in order for it to be useful on the other end. And that's why we're spending this time today, just putting in a little bit of time, proactive time up front to understand it, kind of create some standardization around it so that everyone can be on the same page, and that it can be something useful to you moving forward and not something that's too much of a burden, or at least that the value outweighs the burden of it. That's, I think, what would be our ultimate goal. We obviously want to dedicate as much time as possible to providing those direct services, but recognizing that it is valuable to put some time into doing the data entry and getting it right. So just trying to create a little bit of buy-in here and understanding around all these data elements. There is a purpose. It's not just let's waste some people's time with putting all this data in. There's a purpose and a rhyme or reason to everything. So we have here our list of the program specific data elements, and these are, you know, when we talk about universal data elements, program specific, universal is what all HUD funded and federal partner funded programs are collecting. And then when we get to program specific, they're not required across all programs. It depends on your program. So these are the ones that are required for PATH. And you'll see the list here. And of course, your COC or your specific PATH program may choose to collect some additional data in HMIS. So this is what we're covering here is kind of the bare minimum of what's required on the SAMHSA end of things. So let's go through these a little more closely. So our income and sources, non-cash benefits, and health insurance, these relate back directly to PATH outcomes. So when you're looking at the PATH annual report, this data will get pulled from HMIS and uploaded into PDX for the PATH annual report. And that will be looking at project entry, how many PATH enrolled clients had income from any source, and at project exit, how many had income from any source. So there you can see an outcome. How successful was our PATH program in connecting clients to income, to non-cash benefits, to health insurance. So these are some specific PATH outcomes that SAMHSA in particular are interested in, and federal government overall. Then this other set of program-specific data elements relate back to the COC data and are helpful in determining client eligibility for a variety of COC programs. So I think when you're kind of going through the data collection process with clients, it doesn't have to necessarily be just I'm going to ask you these questions and you have to answer them. It can be created in more of a storytelling way, like you're listening to their story, you're understanding what their background is, and through the course of that, collecting information and using that information to assist them. So the more information you have about their background, their past experiences, their needs, the better able you'll be to assist them. When we look at the mental health problem and the substance abuse elements in particular, those taken together determine, there's a report out on the PATH annual report for how many PATH enrolled individuals have a co-occurring disorder. So co-occurring substance use and mental health disorder. So that's how that element gets calculated. So those are obviously important to report accurately, so that element is reported accurately on the PATH report. Okay. And then looking closely at two of the remaining program-specific data elements. So there's this element called current living situation. This is how we're collecting information about contacts. And so we talked at our very first training, for those of you who were able to join for that one, about the workflow, and we're going to look at that in more detail, but we talked about how contacts are collected at each point in the process of engaging, enrolling someone in the PATH program. So the way that that's collected in HMIS is through this current living situation element. And so at the very project start, you're entering their current living situation, and you see here the options there. So place not meant for habitation, an emergency shelter, something else, or you're not able to determine. But the important thing is to get that date recorded and then something inputted into the actual current living situation. That's what's going to allow that contact to be recorded. And then each time that you have a contact with a client, you're inputting this information, just the date and one of these options to record that contact. And that's how that's getting collected. And that's also a way of like measuring level of effort. How many, and you can then look after the fact, how many contacts on average before the date of engagement or before a date of enrollment, or compare that statistic across programs. Is it less, significantly less across for one program versus another? And if so, what are they doing differently? Maybe it's an external factor, or maybe it's something that they've figured out that's really useful for engagement. So these are just different ways that the data can be looked at and used. The date of engagement, so this is something that is used across some of the other HUD-funded programs, but PATH is required to report this as well. It's defined as the point at which an interactive client relationship results in a deliberate client assessment. So when you think about the engagement process as you're doing outreach, hopefully you can think of points where you kind of arrive at that feeling like you've really engaged and you have enough information to do that initial assessment. So you've built enough trust and rapport to be able to approach the idea of collecting all this additional data without scaring them away. And we'll talk about some strategies too for doing the actual data collection. The assessment here doesn't need to be clinical in nature, but just an initial kind of screening. And this is the point by which we want to have all of these data elements that we went through. So having that relationship enough to be asking the questions that relate back to each of those data elements. Data quality begins at the point of date of engagement. What that means is on the back end of the HMIS system, they're looking for all of those elements to be completed by the date of engagement. So it's also like a good marker, like, do I have all these data elements collected? Did I have the relationship enough to be able to at least ask the questions? They have the opportunity to say, I don't want to answer that, or I don't want to answer it right now. That's fine. And you can say, client declined to answer. That's a response option, but did you at least have the opportunity to ask those questions? And then the final set of data elements required for the PATH program, they're referred to on the HUD side as the P series. I'm guessing that stands for PATH. So services provided, referrals provided, path status, and connection with SOAR. So we had looked at this list of services provided in our first training, and I know that there's certain ones that the North Dakota program really focuses on. And again, some path programs across the country do just one of these, some of them provide all, and some just a small subset. Rather than like sitting here and reading through definitions of all of these, I want to just pause for a moment and see if anyone has questions about how any of these are defined. If you ever get kind of tripped up in terms of, I don't know what to enter for that. You know, I just had a contact with this client. I know that I did something to help them. I don't know how to capture it in terms of the service that I provided. As we mentioned also in the first training, we're putting together a manual that will have the specific definitions for these. So that's something that can be an ongoing reference, and be useful if you are ever not sure how to capture something. But I want to leave a moment to feel free to either enter into the chat box or unmute yourself if you have any questions about this. I think you're probably using the case management category.
Amy, I've got a question.
Sure.
As far as the re-engagement category, I have on top, you know, this has happened quite a bit, and I will have gone through the entire path process with them. They've been engaged. They've been, you know, they meet path criteria. They're housed, and maybe a month or so after, they say, you know, I'm struggling with this area. Can you help me apply for Social Security disability or some type of Social Security income? Should we re-engage them at that point, even though they've been housed and have actually gone through the path process? That's something I struggle with.
Sure. And you cut out at one point, I don't know if you said that, were they in these like scenarios, are they exited from the PATH program the initial time?
Yes. They have been they've been entered into the, you know, into HMIS. I've captured every contact with them, and then I effectively exit them from the PATH program. And then, you know, say maybe a month or two passes and they come back and say, are needing some type of case management or assistance with something that perhaps they didn't get in the beginning, or have decided this is something they now need. Should I even if they are housed and they're still housed, and successful in that at this juncture, do I re-engage them for purposes of assisting them with other case management issues that might arise in HMIS?
Sure. So there's a few different kind of ways that this scenario could go. And so I'll start with just the re-engagement category here in the services provided. The way that it's defined and intended to be used is for people who are still enrolled in PATH, that like during the point of being enrolled, you lose contact with them, maybe just for a few weeks, a month, and you need to be able to re-engage. And then there's like that process where you're kind of starting again with building the rapport. And so it's really basically kind of a way of capturing outreach that happens within the enrollment phase. And that's what the re-engagement is meant to capture. For someone who's been kind of fully exited from PATH, and then like the scenario you're describing, then needs assistance, I think it really would depend on that specific situation, the type of assistance needed, and kind of the level of effort on your part. And there might need to be like a degree of judgment that happens. And also their specific, like if they really are stable in housing, or is it like the assistance that they need will help them to maintain that housing? Like, kind of, do they fall into that potentially imminent risk of homelessness if they didn't get that assistance from you? And that could be kind of justification for re-enrolling in the PATH program at that point. If it's something where you could easily just kind of connect them to whatever they're reaching out to you because you're a great support in the community, but they really just need a connection to that mainstream resource, like you were saying, like an SSDI application or something like that. If that's something you can assist with through SOAR, then they don't need to be re-enrolled in PATH for that. If it's something like a quick referral that you can get them connected to, certainly want to help them with that, but they don't necessarily need to be fully re-enrolled in the PATH program. And again, depending on how stable they are in their housing, they might not technically be eligible for that. So I think there's just, with all of this, we're trying to create like kind of black and white data collection silos with that, but there are always gray areas and judgments that need to be made. John, I don't know if you have any thoughts around that specific scenario.
So the only thing I'd say is that, as Amy said, it's definitely not a re-engagement, because all re-engagement happens prior to project exit.
Gotcha.
But the only other thing I would say is that, from a holistic perspective, you have to ask, why is this person coming back? Presumably you as a PATH operator usually hand them on to some level of case management once they're housed, and encouraging them to use that case management rather than coming in and asking for small pieces of work to be done. Having said all that, living in the real world, let's face it, somebody shows up, you can do a quick referral. You know you're going to do it. I know you're going to do it. Everyone knows you're going to do it, because that's just, that's just what outreach does.
That makes perfect sense. Jonathan, Amy, thank you so much. That really clarifies it for me. In the beginning, I'm fairly new to, I'm not new to HMIS, but I'm new to PATH. And so, case management, sometimes, it does call for us to, especially if they had a good rapport with their case manager, they just call on us sometimes. And so I think for me, it's just been a matter of knowing, when I can refer them out for these services to another agency that is more aligned with what they're asking for. Like, if it's somebody that, specializes in, we have a place here called Angel Advocates that is really very hands-on with the Social Security disability process, and they're just phenomenal to work with. And so I send a lot of people their way. But no, I just was kind of confused about the re-engagement, the term re-engagement. It just kind of, I wanted some clarification on that. So that helps. Thank you.
Yeah, no, it's definitely confusing. And I'd say in the scenario where you determine that they kind of still are eligible for PATH, like they could say, I'm really behind on my rent and I just got an eviction notice. They could reach out to you with that. That would place them in that imminent risk of homelessness category. You know that there's some significant services that they now need help with again. You'd basically be starting at the start of the data collection workflow with them. So you'd start with a new project entry date, a new date of engagement. You'd want to go through their record, make sure if there are any updates, you already have the record filled out, which is great, but are there any changes or updates to any of the previously collected elements? A new date of enrollment, and then from there recording the services that are provided there. So you might be providing one-time rent for eviction prevention within that new project engagement. So so everything all the services that are listed here are provided in the window of someone being enrolled in PATH and before they're exited for PATH. But that term re-engagement is confusing. All right, so I'm going to hop forward to the referrals. Again, same thing where these are all specifically defined, and we talked about with the first training around referrals really being dependent on who's providing the service. Is it a path-funded person or not? And so when you're referring someone to receive any of these services from someone who's not path-funded, then you can record that as a referral provided. And then HMIS will also be asking you to indicate whether or not the client attains that referral. Do they actually go attend the appointment that you're scheduling, or get the service that you're trying to connect them to? So you record attained or not attained. Any questions with how these referrals get defined? And again, there will be the full list of these definitions in the manual. Okay. We'll have to hopefully have time for questions at the end too. So, okay, these other P series path program specific data elements, the path status. This is a really important one. This is capturing whether or not someone becomes eligible, becomes enrolled in PATH, and if that's because if they don't become enrolled, was it because they weren't eligible for PATH, or was it for another reason? So you're recording PATH status at the point that you know whether or not they're eligible for PATH and whether or not they're enrolled in PATH. So you're going to indicate, yes, they're enrolled in PATH, and there'll be a date of enrollment. No, they're not enrolled because they're not eligible. So that's either through my screening and assessment, I determined that they don't have a serious mental illness, or they're not experiencing homelessness or at imminent risk of homelessness. Or they weren't enrolled for another reason. Maybe they're eligible, but they don't want PATH services. Or they're outside the service area that you service, and need to be referred to another PATH or another program, or you're not able to locate the client. And then again, this definition for PATH enrolled, so they have to be PATH eligible, and the provider and the client have agreed to engage in services, and that record has been started. So that's how SAMHSA is defining someone who's enrolled in PATH. Connection with SOAR. So this is really just looking at, has the client ever been connected to SOAR, whether that's through PATH or not. It doesn't matter who's providing that connection. This is actually one of the PATH outcomes that gets reported federally each year, is how many PATH clients are connected with SOAR. SOAR is a SAMHSA funded program, so they're looking at how closely are these programs working together. And the status can change. So if that ever, like, it's helpful to check in, and you probably know from working with the client, if throughout the course of their PATH enrollment, they do get connected with SOAR, then you go in and update this element. So it may be no at the start, but then a few months later, you might have to go in and change that to yes. Okay, we'll go ahead and launch another poll. So this is just a quick quiz. Make sure that you're staying awake through all this data element description. So if a client does not become enrolled in PATH, then the PATH status does not need to be completed. True or false? It's kind of like a double negative, but I couldn't think of a better way to word this question. So give you a minute to think about that. Okay. And we've got everyone with with the right response. So even if they're not becoming enrolled in PATH, we still need to complete that PATH status element and indicate why they're not enrolled. So either ineligible or for another reason or unable to locate clients. So great. Let's forward. All right. So here's our workflow that we looked at with our first training, and just a way of kind of conceptualizing. So basically, we've gone through the kind of starting out at the who of who's collecting this data and using the data and what the different roles are. And then we just went through the what are the data elements that need to be collected that are required, at least on the SAMHSA end. And there might be some other requirements that you have locally for your specific program, but this is kind of the bare minimum of what's required for SAMHSA. So now we'll talk about the when. When do each of these things get collected and when are they required by? So we have a project start date, and that's the very first contact that you have with a client. And then we talked about how we're collecting contacts then, like from that point forward, every time you have an interaction with a client, you're recording a contact in HMIS, and that's recorded through that current living situation element, just the date and the location, and just those two things in, and you get the contact recorded. From that point of first contact, you're moving forward, you can have a wide range of contacts, and you could move through these phases. All of the first 3 phases could all happen in the same day, the same hour, or they could take months. So there's a wide range, and it just depends on the client and the situation. So you have your project start date, any number of contacts that will lead through to the point of engagement. So that's that point that the interactive client relationship results in deliberate client assessment. So by that date of engagement, you have the ability to at least go through and collect as much of the universal data elements and program specific data elements as possible. At least have the ability to ask for that information from the client, giving them the ability to decline to answer any or to stop going through that assessment or interview if they're kind of getting overwhelmed by the amount of information being requested. But it's that point that you have that interactive relationship. And by that point of engagement, you should then have enough information to make a determination, are they eligible for PATH or not? And so if they're not eligible, obviously then at that point, they need to be exited from the PATH project, can obviously do connection to whatever they are eligible for in the community. If they are eligible for PATH, then you would go ahead and enroll them, assuming that they want to receive PATH services. And then that enrollment date is the point at which the PATH specific data elements get collected. So from enrollment forward, you're entering the services and referrals that you're providing to them with each interaction. So up until the point of enrollment, you're just recording contacts that are happening and trying to build out that record with the universal data elements and program specific elements that you can get. And then from that enrollment point forward, you're still recording contacts, but also collecting information about services and referrals that you're providing. And then moving forward through to project exit. And that would happen when the client attains stable housing, or they're transitioned to mainstream resources, or they choose to leave, they don't want to receive PATH services anymore, or you don't have contact with them for 90 days. And in any of those scenarios, you would exit them from the PATH project. So let's look at this a little bit differently. This is basically some of that similar information, but in chart form. So we're looking at the data elements that we had just gone through, but the point at which they're required by, or the points at which you would be inputting them. So at the project start, in terms of universal data elements, you'd want a name or at least a way of identifying them in the system. It might just be a first name, it might just be a descriptor so that you know how to find that record again if you didn't have the opportunity to catch their name. You need the project start date, the relationship to head of household, which in most cases here for PATH would be self, the client location, and then prior living situation. And client location, really, that's just a COC code. So that probably would be the same thing each time for your clients, unless you're crossing COCs in your outreach work. And prior living situation is capturing where they're really living or residing just prior to the project start. So that's why that's important at the project start date. And then the rest of these, again, by the date of engagement. So it's just the idea that as you build out that rapport, you could sit down and have a full assessment with them to try to collect these remaining universal data elements. And then these program-specific data elements, all of them by the date of engagement. And you'll note that the current living situation is the one that gets collected throughout. That's the one that's capturing the contacts. And then the date of, by date of enrollment is all of the, or after the point of date of enrollment is when we collect the services provided, referrals provided, PATH status. HUD has connection with SOAR listed across the board. I think they're really kind of emphasizing how important this one is for PATH reporting. So I'd say I wouldn't like stress about the very first time that you talk to someone asking if they're connected to SOAR. Might not be the best engagement tool and might not know what SOAR is and you'd have to explain it. So I think really though, it's just like as soon as you can get that information, and that's something helpful for knowing if they need assistance with the SSI and SSDI applications. And when you can offer that, that might be a really great incentive for them as well to be connected with you, because that can open up a lot of doors getting the SSI and SSDI applications approved. So just kind of like a different way of thinking about the workflow. These charts are in the manual that we developed. They're also in the PATH HMIS program manual that was developed by HUD. So it can be a helpful way of just remembering when things are required by. But I think the main summary is that by the point of engagement is you're really kind of trying to build out the record. But by the point of engagement, having that record completed, or at least having the opportunity to ask the client to provide the information. And then after the point of enrollment, collecting this PATH specific data.
Amy, I have a, this is Ashley in Bismarck. I have a clarifying question. So to have all that information on the date of engagement seems to be a lot. Am I the only one that thinks that? Like today I did street outreach and some people didn't even want to provide me their names. I got nicknames. Some people were intoxicated. So to go through that, all of those and have that on the date of engagement seems to be honestly a little bit impossible at times.
Yeah, and I'll let John hop in too, but I'd say then you probably haven't reached the date of engagement with those individuals. So there's contacts that happen prior to that date of engagement. It doesn't have to be an immediate thing that happens. That's your judgment. And again, that the definition of the date of engagement, the point at which an interactive client relationship develops, so that to the point where a client and assessment can be completed. So whatever information you can gather, that's great, and you put it in when you can, but you make that determination of, okay, I feel like we've reached the point of engagement now, and I have the ability to collect this information, so I'll put in that the date of engagement is X date. It might be the 10th contact that you have with them.
Okay, I got you. I think I was confused on that then. So then in HMIS, when like today, I met actually with several people that didn't provide their name. And so I wouldn't do an entry at that point? I could just do like a note and put them in HMIS. Is that correct?
So you'd still start the HMIS record for them. So you do a project entry date. And then, so that's like basically like, it's confusing. Like you're entering them into the path project, which is different from like a path enrollment. So you do project entry date, and then you record the contact with the current living situation element. So you just put the date and where they were located in terms of their living situation, on the street, in a shelter, in a safe haven, wherever that might be. And that might be it. Any other information you might have that will help you locate that record again.
And this is where it gets complicated, because,
Yeah.
you know, if someone will give you a name, you're effectively naming them Red Hat on Blairsville High Street. And that's fine, because you know who Red Hat on Blairsville High Street is. So when you go out tomorrow, you will be able to do that. What happens if your colleague goes out and then they're like, Red Hat on Springfield High Street, because they've moved around the corner, and that's where it gets complicated. So that naming convention between you and your colleagues is pretty critical. You know, and so I know Amy used to talk about how you would often, you know, have quick conversations about new people that you're just starting to put in with your colleagues, so that everyone knew it, so you didn't get a lot of duplicates. But, you know, as Amy said, it might be, I mean, let's face it, if I met you, I'm not going to tell you all these things about myself. And frankly, if I had to, I would lie about every single one of them. So, you know, it's
And it would
unsurprising
possibly
that
shatter rapport.
Right.
Sorry?
Exactly.
Yeah.
Right. You don't want this information gathering to come at the expense of the rapport with the client.
Yeah.
So it really varies. And I mean, you know, I certainly found sometimes I was, I don't know if pleasantly surprised is the right descriptor, but there's some individuals that I interacted with that were just so used to the system and so used to telling their story and providing all the information under the sun that they just wanted to get it out of the way, and they wanted to do it immediately. And they just like, here's the consent forms, they just sign it and want to get on with it. I want the services. But that's not the typical case. And especially when you're doing outreach to this population, it takes time, and you're not going to start by saying, hi, you know, my name's Amy, what's your social security number? That's not a good way to start off. So you really have to build that rapport, and then be able to explain to them, here's why I'm asking these questions. Here's why it can benefit you to provide as much information and as accurate information as possible. If you're not comfortable providing this information at this point, I understand. If at any point, and then you can ask them again a week later, you know, do you feel like sharing this information right now? We could build out your record more and maybe connect you to some more services. There's always the response option of, I think it's called client refused. I like to think of it as like they declined to answer it at that time, and you can't blame them for not wanting to.
But just to reiterate, it's perfectly fine for your date of engagement to be 6 weeks after your start date.
Okay, thank you. That clarifies for me.
And that'll help your data quality, because they're looking at the quality as of the date of engagement. So if you enter a date of engagement, but the rest of the record's blank, that won't look great.
Okay.
So,
Okay, that makes sense. Thank you.
yeah. Great questions. All right, so let's do a quick review with these contacts. Again, the contact element is now that the current living situation element, where you're putting in the date and where they're residing at that point of the contact. So contacts recorded at all instances, starting with project entry, only after the date of engagement, only after the date of enrollment, only at project start, date of engagement, date of enrollment. none of the above. I'll give you a few more seconds. Okay. We have, all right, so we've had 2 people voting with the correct answer. So all instances of contact beginning with project entry. So first time you contact the person, starting that record with whatever information you can, that will help you to identify that record. And from that point forward, every time you interact with the person, entering a contact with just recording the date and where they're residing at that point. Okay. All right, I'm going to turn it back over to John. We're going to go through some tips for trauma-informed collection and streamlining it. And John, I'm going to ask you to leave as much time as possible to do our case study, because I think that will help piece these things together.
I was going to say, I'm going to do trauma-informed data collection in a very untrauma-informed way, because I'm going to do it quite quickly. You know, also, I think that, you know, many of us have been, you know, we're used to doing outreach. And so a trauma-informed approach is kind of built within us. But just briefly, you know, we talked about that rapport with Ashley just a few minutes ago. And, you know, that is critical when you're doing data collection. You want to build trust and rapport and, you know, a back and forth with people before you start trying to gather any information in any kind of deliberate way. You know, you're going to want to do it in private, and, you know, allow our clients to lead that conversation so that it feels natural. You know, and then obviously we need that consent to record data. Next slide, please. So, information allows people to make data-driven decisions, and that's true for our clients too. So we let the client know what we're recording, why we're recording it, who has access to it, how the data is kept confidential, you know, and when it's used and when that confidentiality could potentially, you know, have its limits. We understand that some of these questions can be traumatic. You know, people who live on the streets experience trauma. We know that. So, you know, people may refuse to answer questions, and that's okay. People may, you know, decide not to answer that question today if they're having a bad day, but be more willing to talk about it. It's all in our approach, and that, you know, they have the right to stop at any time. Let's move on.
And I'll just add into that. I think taking this approach too can be a really good way of building the trust and rapport. The fact that you're kind of respecting the client enough to go through all of this and explain it all and take the time to explain it, see if they have questions. I think a lot of times they're used to programs just kind of expecting them to provide this information and not acknowledging that it could be traumatic or difficult. And so I think putting that all up front is a good way of building that trust and rapport.
Let's go to our next slide.
You've got
okay,
it.
Being organized up front helps a great deal. You know, our clients have to tell their stories over and over again. So eliminating
John, I think you froze. Is he frozen on other people's ends? Yeah. Okay. Yeah. I'm going to pick up and then hopefully he can rejoin us. So these are some tips for effective data collection. So when we think about the burden of the time that it takes to input this information, and again, like the goal here is to have the value outweigh the burden of it. So here's some ways to kind of streamline it. So looking at like, what do I need to collect the data? Do I have separate spreadsheets? Are there extra paper records? Are there things that I can eliminate and just streamline it? Maybe you need those other things and they're useful to you, but just thinking about what your process is like. When you're doing case notes, make them as concise as possible. You might want to use a bullet point format or have a pre-made form that you fill in that just kind of prompts you with the information that you want to input. When you have the information ready to go, when you're doing the data entry. So with most things, it's hard to multitask, and it's once you get kind of going with something, if you have to stop and start again, it makes it more efficient. So as much as possible, when you can set aside a regular block of time and just kind of head down, get it all in there, it'll be like as efficient as possible. If you're using any paper forms to collect the information in the field, take the time to make sure that the information is lining up with how it appears in the system in HMIS. When you're going for data entry, it'll make it a lot easier to transfer that information if it's all in the same order. So there might be some things you can do up front to streamline the information. You're back,
I think
John?
I may have dropped off for a bit. Yes, and in fairness to me, I gave the best answer I'd given to those slides in years. I'm sorry you all missed it.
Man, too bad we don't have that. All right, so we have a few minutes left to do a case study that we kind of hope will pull all the different pieces together. It's hard to summarize what a path interaction looks like, so we will suspend our disbelief with certain things and just trying to summarize what a typical interaction could look like. But obviously there's a really wide range of how some of this could happen. But in this scenario, Kevin's the path outreach worker. He meets Sally. They have an initial conversation. He learns that she's been staying on the streets and in shelters for quite a while. And she doesn't want to talk anymore that day. So they've had that initial contact. He sees her again a few days later. He explains his role, services that are available, how he could help her, gives her his business card and says, this is when I'll be back next on my outreach rounds. So that's where we're at so far. They've had 2 interactions, just starting with that, building that relationship. So going to pull up this. So should Kevin start an HMIS record at this point? Have people very quickly being confident in this one, which is great. So yes, okay, like we just talked about, you'd have a record, probably that would just say Sally and the contact dates. Okay, so now looking at the point in the part in bold here, this is the continuation of our story. He sees her again the following week on October 15th. They talk more about her needs, the ways that he could help her. At this point, he is able to complete an assessment, determines that she's eligible for and she's interested in PATH services, and he enrolls Sally in PATH. And he then discusses an initial service plan. So here's what I'll do to answer these questions. Pull up this slide with the actual dates. So you can see the full scope of our case study here. When that initial interaction happened. So what's the project entry date, the date of engagement, and the date of enrollment? I'll give you a minute to answer each of those. We have 2 people.
I want to go to, I want to change my answer to October 15th as the engagement date.
Okay, gotcha. Cool. All right, so let's.
I answered too fast.
All right, fair enough. So let's go ahead. All right, so project entry date, yep, October 1st. That's the very first contact that he has with her. So that's when he's starting that record with whatever information he has. So date of engagement, yep, so that's October 15th. That's the point at which he was able to complete that assessment. So they had that relationship enough to go through the assessment. Oh wow, we're split across date of enrollment. Okay. So date of enrollment, this is really connects back to that path status question. Are they enrolled in path? And then if yes, you'd put the date. If no, why? Because they're ineligible or for another reason. So date of enrollment is also October 15th. So it's this kind of system logic where the date of engagement and the date of enrollment can be the same thing. And I would imagine that there would be a fair number of times where that would be the case. If you're at the point where you can complete that assessment, you probably have the relationship enough to determine eligibility, and if they are eligible, actually go through with enrolling them in the program. So in this scenario, date of engagement, date of enrollment are the same. They're both October 15th.
So Amy, can the date of enrollment ever precede the date of engagement?
Good question, John. No. Date of engagement always comes first and maybe on the same day, but engagement happens first, then enrollment. And engagement is what allows you to determine whether they're eligible to be enrolled. Okay, so all right. And then we've got 2 more here. So should any services provided, path funded elements be entered at this point? So let me take us back again. So again, where we're at in this scenario, he completes an assessment, determines that she's eligible, enrolls her in the program, discusses an initial service plan. So at this point, any services provided. Okay. In the interest of time, move forward, we have the correct answer here, yes. And those services at this point would be the screening service, because he did the screening to determine what her needs are. And then the initial service plan would qualify as a case management service. So building out that wellness plan with her, determining what her goals are with path services, that would be recorded as a case management service. I know we're reaching the end of our time. Let's go through, oops. I think there's 2 more points to our scenario. If anyone needs to drop off, we completely understand. They meet again the following week, discuss the service plan. She's interested in being connected to primary care. He assists her in making that appointment for a physical. She's also interested in applying for housing, so he assists her in setting up an appointment to complete the coordinated entry assessment at a local agency. So which referrals provided, and this just having you can either unmute and say what you think, or go ahead and put that in the chat box. So
Housing services?
sorry, say that again.
Housing services?
Yep, that's for the coordinated entry referral. Yep, exactly. Okay, so housing services is where that coordinated entry referral would get captured, and then also
Primary.
referral for primary health. Yep, exactly.
And community mental health?
Not yet. That was in the last scenario.
Oh.
You're ahead of yourself, John.
Sorry.
Well, so this is really, so now we're just talking about kind of the rest of the interactions that they have. So he continues to work with her for several months. She attends the primary care appointment, so that would be an obtained referral. He also helps her connect with a psychiatrist and therapist at the local community mental health center, so that would be a community mental health referral. He works with her to submit an SSDI application based on his SOAR training. He connects her to a temporary housing program while she awaits permanent housing. So they meet again at the end of May, discuss the status of her service planning goals. She feels she has the support she needs through her health and mental health providers and knows how to reach Kevin if anything changes. So should Kevin exit Sally from the PATH program as of this meeting on May 25th? So it's just, would this qualify as a PATH exit? And we'll take us back. So they meet on May 25th, discuss their service plan goals. Okay, so we have two people saying no. Oh, three.
Okay.
If anyone is willing to, because maybe there's a difference in your specific kind of local protocols. So here, what we would typically say is, yes, she could be exited from PATH, and this would be under the transition to mainstream resources reasoning for exiting from PATH. So if she feels that she's kind of fully set up with the psychiatrist, the therapist, has what she needs in terms of temporary housing and knows how to get the information when she's up for permanent housing, we would say, yes, she could be exited from PATH at this point because she's supported through mainstream services. And then that basically allows the PATH worker to have more space now to kind of work on the outreach with other clients. So
would you have to, Amy, or is this more of a judgment call? I'm thinking of the question earlier where people might come back, a week or so later with something else. So is that something that people can take a slightly more cautious approach on?
Mm-hmm. Yeah, you could definitely take a more cautious approach and decide not to exit at that point. I think if a few weeks later feel like maybe you've checked in by phone again and she's still doing really well and you feel like, okay, at this point I can exit, you probably can go back and date the exit date as of your last interaction with her. But there could definitely be judgment call there, but it would also be allowable to exit at this point and to know that the exit reason is because she's been transitioned to mainstream resources. And there is always the ability to create a new project entry if she needs assistance, like that scenario that we talked through earlier. So our case study basically just kind of took us through each of these points from project start through engagement, enrollment, and exit in just one scenario. Obviously, there's a really wide range of scenarios that you'll come across, but hopefully this has kind of helped conceptualize how to apply the data collection across these various points and help you feel more confident in knowing when to enter the data, knowing that you're entering it accurately, and thinking through ways to make the data most useful to you. So I know we went past our time. If we have any remaining questions, we're happy to take them. We're also available by email with any questions. And we've really appreciated the interaction and questions throughout. They've been really great. So
Amy, I think the only thing that I would add would just be that you are going to include the previous slide in the manual, correct? Because I think that really shows a good flow for a PATH client. It's just something I think that would be very helpful.
Yep, exactly. Yes, that will be included in the manual along with kind of description and information that goes along with it. Wonderful. So what I'll do is I'll ask Bina if you can enter the evaluation link into the chat box. Similar to our other trainings, we have a short survey that we'd love for you to complete afterwards. You can just use the link in the chat to go to SurveyMonkey and complete that evaluation. We'd love to hear your feedback. This concludes our training series, but we've really enjoyed our interactions with you, learning more about your program, and we're building out this manual now to make sure that it's a really useful resource to you moving forward.
Yes, thank you so much for everything that you guys have provided. I think we have a much clearer idea of how the PATH program is going to work in North Dakota, and I really appreciate you being available later on for any questions. That's really a very helpful thing. So thank you guys so much.
Yeah, no,
thank you very much.
Thanks for organizing this, Tammy, and thank you to all of you for your engagement with this and for all the work that you do. Certainly, we know you don't have easy jobs, but have a lot of respect for all that you do, and it's so important. So thank you.
Bye.
All right,
Bye.
thanks everyone. Bye.
Bye-bye.